past. And I'm happy to say that FDOT is going to be assisting us in acquiring vehicles. We are in desperate need. We haven't been able to get vehicles, as you all know, for a couple of years due to supply and demand issues and contract negotiations and all that minutia. But we will be very grateful and pleasantly served if we do access some vehicles, acquire some vehicles and operating funds. Thank you.
I have a question, Vice Chair, for our presenter. Hi.
Hi.
How are you doing?
Good.
Thank you for being one of the agency's best providers. I just have a question about, and thank you for, because you knew I was going to ask this question about 0 trips being made by Keys doing, Citrus Arc doing business as Key Training for employment. Have you all seen success with that for our individuals with disabilities?
Oh, absolutely.
Using the county instead of Key
Absolutely.
as a resource to get to the job?
Yes, and we've been doing that for a long time.
Okay.
We also, as you know, gave up our 14C certificate, so to pay below minimum wage. So
Right.
we used to have employment numbers in there when we had the 14C certificate, but since we don't have that, we don't. But we've, for decades, have used other means for community-based employment.
Okay, so here's a harder question, and
Mhm.
this is if you don't know, that's fine. If for some reason county transit was not available for someone that we serve together, would Key be
Key
a
would provide the
partner
transportation,
to the
yes,
employment? Okay,
but there wouldn't be any billing. It would
okay.
be
That would just be, I know, a very unique, rare
Yes,
blooming
and it does
exception.
happen, because
Okay.
sometimes they have holidays when we don't, and our,
Okay.
our clients are still working, so yes, we
Okay.
still will provide it, but we don't count it.
Okay,
It won't be reflected in any numbers,
okay,
because it's incidental.
thank you, I appreciate that.
Okay.
Thank you, Teresa.
Good question.
Any other questions? The next one is action item, annual review and approval of the LCB bylaws. The Commission of Transportation Disadvantage requires that the LCB review and approve their bylaws on an annual basis. Staff is proposing the following changes. Florida statute citations were added. The absenteeism process was updated to report to the CTD versus state representatives. And verbiage for alternate members, non-voting members, and grievance committee process was updated. Staff recommends that the LCB review and approve the LCB bylaws and authorize the chair's signature thereon.
Motion is needed to approve the annual review update of the LCB bylaws and authorize the chair's signature therein.
I'll make that motion. Dave Newell.
Do I have a second?
Second.
I'll second, Deirdre LaBelle.
I have a motion and a second. Are there any other comments? All those in favor?
Aye.
Opposed? Passes. Item F2.
Thank you, is the annual review and approval of the LCB grievance procedures. As part of the grant agreement with the Commission of Transportation Disadvantage, the MPO is required to annually review and approve the LCB grievance procedures. Attached are the updated procedures, which have been modified to include the ability of the complainant to utilize or contact the ombudsman at the Commission for the Transportation Disadvantaged if dissatisfied with local steps to resolve an issue. The Transportation Disadvantage Service Plan will be updated with the approved procedures. It is recommended that the LCB review and approve the LCB grievance procedures and authorize the chair's signature thereon.
A motion is needed to approve the LCB grievance procedures and authorize the chair's signature therein.
So move, Katie Lucas.
Do I have a second?
Second, Dave Newell.
Pardon me. I have a motion and a second. Are there any other comments? All those in favor?
Aye.
Aye.
Opposed? Passes.
right.
And Mr. Douglas, I just wanted to mention for a point of order that since we had done introductions during the annual public workshop, and when we convened our workshop, Mr. Emilio is Santiago, am I doing that correctly? From my vision? So I wanted to note the record that he is with us and joining in the vote process. So I wanted the record reflected of that.
Yes, ma'am, thank you.
Vice Chair, I'm so sorry, I need to raise an issue that was already voted on. I apologize, I missed, this was an oversight, in the bylaw. I think this is the bylaws, I'm looking at this. This is the bylaws, the beginning of the bylaws?
Yes.
Okay, I do not see the State of Florida Agency for Persons with Disabilities listed as having a designated member, voting member in the list of members. And since we are a member of the Florida Commission, since our director is the state member and I'm the local member for each county in my region, I think the APD needs to be added to this list. For your consideration, sir.
Yes, ma'am.
Apologize, I didn't catch it earlier. I was trying to read. It's going so
No,
fast.
I'm glad you did catch it, thank you. So what needs to just happen is, since they've already voted on this, they just need to amend that motion. The motion maker was Katie Lucas, I think, yes. So Katie would just have to include that addition to the bylaws, and the seconder would have to agree.
Move to approve the amended motion, adding the agencies for a person with disabilities into the bylaws.
Second that, Stephen Brown.
All right? Dave Newell was the original.
I'll second that, yes.
Okay.
With additions.
There you go.
All right, thank you so much for that. Then all in favor of the amended motion?
Aye.
Any opposed? Good to go. Thank you for bringing that to our attention.
Thank you for
Thank
catching
you for your
that.
consideration.
We're on number 3, the election of grievance committee members. Pursuant to the Transportation Disadvantage Service Plan, the LCB is required to appoint grievance committee composed of LCB regular voting members. On February 10th, 2022, the LCB appointed the following members to the grievance committee. David Douglas, Chair, William Berta, Vice Chair, Jeffrey Bormrod, sorry if I mispronounced that one, Deirdre Barrett Lavelle, and Stephen Brown. The LCB will need to appoint grievance committee members for 2024 to include a chair and a vice chair. It is recommended the LCB appoint 3 voting members and at least 1 alternate voting member to the LCB grievance committee to include a chair and a vice chair. We need to make some nominations.
For the first member of the grievance committee, can I nominate myself?
I'll
I don't know if
nominate
I'm
Dave-
allowed to do
I'll
that.
nominate Dave Douglas. The silence is deafening.
Do we need to get all 4 before we go to?
How often does the grievance committee meet?
And so,
On demand.
because it's very, very interesting that they have not had to meet, because most complaints or issues are immediately handled by
Oh, there you
RCTC.
go.
So the chance of them meeting is very small, but it is a requirement to have the establishment of that committee.
I would be willing to serve.
And what is the number of members required?
We have to have 3 members and 1 alternate member.
I'll serve as well if somebody wants to nominate me.
I'll serve.
I'm sorry, who was that?
Stephen
Mr.
Brown.
Brown.
Steve, Mr. Brown? Okay.
Can we get someone to nominate the 4 people, please?
Well, we need an alternate member.
I move we nominate that slate for this coming period.
We still need an alternate member. I did not get
Well,
it.
we have actually 4. Mrs.
Oh, I'm sorry,
Lucas, Jeanette,
Uh,
Mr. Brown, and Mr. Douglas.
Mr. Douglas, okay. All right,
We ready?
we're ready to move then on that. Mr. Osborne, if you're ready.
I move that we take that slate that was just mentioned, and use that for the next year's period.
I'll second that. Deirdre LaBelle?
Any other comments? All those in favor?
Aye.
Opposed? Passes.
Now do we need to decide who's the chair and the vice chair?
Yeah, the chair, go ahead.
I'm sorry.
No, I'm sorry.
From the members above, we need a grievance committee chair and a grievance committee vice chair.
I'd like to nominate Dave for chair.
You really got it out for him.
I'm telling you,
Do we have a
hurt me,
second?
beat me, whip me.
I'll second that.
Dave Newell seconded. All in favor?
All,
Aye.
opposed? Passes.
Is Mr. Stephen Brown stays as the alternate?
Well, right now, we just have Mr. Douglas as the chair, and then we need to decide on the vice
Okay.
chair,
Okay,
and then the other member, and then the alternate.
and there's the four, okay.
Well, he brings a good point of order. Mr. Douglas is an alternate member, so if the three committee members cannot meet, then Mr. Douglas would fill in. So it doesn't make sense for him to be the chair since
Yeah.
he's an alternate.
Right, right. I thought those were the rules.
I thought he was,
Okay.
I was right behind you, Emilio. I was like, oh, well, this is not gonna work.
I thought I
I got
was
lost in the
remembering, but that's
translation
okay.
there, yeah.
Okay, so let's go back to the slate. If we did Katie Lucas, the regular members are Katie Lucas, Jeanette Estes, I'm sorry if I pronounced
That's
your
a
name.
perfect pronunciation, thank you.
And Stephen Brown were the regular members, is that not correct? And Mr. Douglas was an alternate member.
It doesn't matter to me.
I thought we voted them
Yeah.
all in, and then we're gonna decide on who the chair, vice chair.
But
So by next
Mr.
meeting,
Douglas is the alternate. If he's the
So he can't be a
alternate, he
chair.
won't be attending a regular committee meeting if they meet. Emilio, we understand that that's where you're at.
Yes, clear.
So, in other words, if you have a committee meeting of your grievance committee, your three members are gonna show up. But if one of those three members has a conflict and cannot
Then
make the
David would
meeting,
show up.
then Mr. Douglas is going to come. So, it doesn't make sense for Mr. Douglas as the alternate to be the chair.
That's true.
So there you go.
You're using logic again.
So we need to know, we need to really actually, either he slides into a regular slot as, on the grievance committee, or you got one of the three that are chosen becomes an alternate member.
I can be an alternate.
Okay.
In place of Mr. Douglas.
Yes, ma'am.
Okay, so Mr. Douglas, you'll be a regular member of the committee, and Mr. Brown will be an alternate. Then in that case, Mr. Douglas can be the chair of the grievance committee.
Now that we got that cleared up.
I'm wore out.
I'm gonna file a grievance right now.
And now for something completely different.
I've been doing this a long time and having to watch what goes on, which Emilio he was on target too there, thank you too. So anyway, we
Saved
now
us from
have,
ourselves.
so if we could just ratify, Mr. Osborne, you agreed to the change in slate and
Yes,
your
I do.
motion? And Deidre LaBelle, do you agree to that amended motion for
I
the
do.
slate? All in favor of that amended motion, say aye.
Aye.
Any opposed? So the amended slate with Ms. Lucas Estes and Mr. Brown being the alternate and Mr. Douglas being a regular member is slated. Mr. Douglas, now you are chair by already a motion and approved vote. Now we need to establish the vice chair if you're not able to be at the meeting for your committee. So one of the three other members would need to be the vice chair.
I would nominate Katie Lucas to be the vice chair.
Katie Lucas is on the floor. Is there a second?
I'll second. Deirdre LaBelle?
Thank
All
you.
those in favor?
Aye.
Opposed? Passes.
Perfect. Thank you.
Now, do you want to approve the whole committee? Is that correct, or do we just?
No, you're
Okay.
all set on your grievance committee, and we appreciate y'all's service. Hopefully, you would not have to meet, because like I said, our CTC coordinator and our transit, service operator, which is Joanne, she is the manager of that. In the past, they have, if anybody had any concerns, they generally address them right away, not necessitating a complaint.
And it's obvious it works.
And that's how it should work, yes, sir.
Section G, feature presentation. Mr. Osborne?
Thank you. Personal note first, I had some trouble getting in here. I just want to thank those that helped me this morning get in here. A little background on the veterans' involvement. Locally, we have a clinic in Lecanto. It doesn't have all the services that all the other facilities normally do. When more work needed to be done, auditory, optical, radiology, it was always done in the villages, and anything beyond that was done in Gainesville. Problem was Gainesville, people are moving north from the South Florida. Gainesville cannot handle what has been handled before. Tampa does have the availability, so our unit in Lecanto is now being serviced by Tampa. There are those of the veterans that are serviced out of Gainesville that need to stay in Gainesville, get that opportunity. Veterans Transportation is a volunteer setup. They are donated vehicles, they're volunteer drivers, and it's very, very unreliable. A friend of mine is blind. I delivered him to a site that he was to be picked up at 7. At 8 o'clock in the morning, he ended up having to walk home. So there's a major problem. This group is able to provide for those. Roughly we have ups and downs, like Joanne had pointed out, because of seasonal fluctuation, holidays. We're talking 50 vehicles, we're talking 500,000 miles. It's a big program that our county and our veterans are not aware of, and it's a big problem to get them aware of it. Currently, there are 50 to 100 trips to Gainesville, Tampa, Villages, and also Brooksville. And the big problem we have is, like you hear with the homeless also, people do not want to participate in the programs that exist. We've got good programs, they handle what is being done. When they go to the facilities, the VA makes their appointments into coordination with the bus facilities. So if you've got a 2 o'clock appointment and the bus isn't running at that time, they can change and make those appointments that way. So they have a very good service, but it's not acknowledged by the veterans, and it's a big program that we have to work with. Other than that, that's basically it. I'd give you some more specific numbers. They fluctuate so much it wouldn't be of value, really. If someone has specifics they're interested in, get a hold of me or Joanne. That's all. Thank you.
Thank you, sir.
Thank you.
Thank you.
Are there any questions of Mr. Osborne?
Did I understand you to say that you had a blind man that was somewhere and transportation didn't show up and he had to walk home?
Yes,
Oh,
he's
wow.
90%. I asked him one time, why did you come here as opposed to West Palm, Miami? The Inverness area, almost all the areas he would have to walk are eliminated. All of the ramps are rubber padded. All the main intersections have traffic control pedestrian lights, and that's why he stays here. He walks from his mobile home park to Wendy's, McDonald's, Publix. He's very well adept but when you strand him in front of the old abandoned Kmart and you're waiting for transportation, it doesn't show. Really puts the hurt on him. So like I say, from the VA, it's all volunteer. Nobody's being put to the wheel, and they do a pretty good job for what they have, but it's limited. So fortunately, we're able to pick up on that. It's a matter of training the veterans to make sure they use it and use it properly.
So it's disturbing to hear this. So is there some coordination that can take place, some remedy, something that can be done so that this doesn't?
The veterans community is given all of the information for the days and times that we go to Tampa, the villages in Gainesville.
Mhm.
And we do schedule all of that. But if they have appointments and are relying on the veteran volunteers because they're not on days that we only go one day a week to each facility. So if they have appointments on other days, they have to rely on veterans organizations and volunteers to get to their appointments.
Okay. So maybe this gentleman couldn't make it on that specific day and,
Well,
But
and
can
we,
we-
and
can
we,
we-
Big
we,
thing that
we
is needed
encourage,
is for the veterans to become aware and use what facilities we have here,
correct.
because they work and they're good.
Oh,
And it works
great.
well with the medical end of it also.
Okay. So we need to get more information, or the people need to become more aware. The information's available, they just need to ask
Right.
the question.
Right.
Okay,
and most of the facilities will change appointments if they know they're coming by, public transportation
Yeah,
or a bus.
that's a big priority,
good,
that they coordinate with the transportation.
good. Wonderful.
It's a good program.
But it does have to be within the parameters of the time that we're
Correct.
doing that service.
Okay. I just want to make sure we kind
Yeah, we did
of
not
clear the
sh-
water there
Yeah,
about
we
things.
did not strand the guy.
No, and I
Yes,
wanted
that
the
was
record to
not
be
us.
clear about what was going on.
That might be our first grievance, just kidding. Joking,
Sure
joking,
got my
joking,
attention.
joking.
Well, thank you so much, and thank you for your service here
Thank you.
and with the
Thank you.
veterans.
Yes.
Very good, thank you. We're on to citizens' comments.
Citizen comments, are there any comments from the citizens?
Yes.
That's you.
That's you guys.
That's the citizens.
I just want to say that.
If you do, please come up to the podium and just let us know who you are.
Okay,
So,
my name's Leanne Smith, I live in Beverly Hills. And even though I'm not a veteran, I'm really for the veterans. We should take care of them. And we have, from what I understand, kind of more veterans per capita than anywhere else in the country because they have an older population. The average population here is 76.
yes,
I think it's closer to 78 now. And I think we really need to build a veterans hospital here because it's an hour and a half to Gainesville, to Tampa, especially if you have a loved one or friend. It's a lot to travel back and forth. And the facility here is very limited on what they serve. We need to expand on it.
okay,
And we need to take care of our veterans.
yes,
You know,
ma'am.
I think tax money be well spent if we built a hospital here. And we have the land. So why not build one? I hate to say in 20 years, that's too late. We need them now.
Right,
I just care about the veterans. If it wasn't for them, we wouldn't have a free country,
yes, ma'am.
okay?
We agree, and thank you for your comments, and they will be documented in the record for you.
And I'm so glad the county bus takes them once a week. I do tell people about the plan.
Good.
But you know what we need? We need business cards with the dates on them that I could hand out to people.
Okay,
With the, you know, the dates and where they go. Because people I know, a lot of people don't know about it.
We
Right.
do have flyers for each of the days with the dates.
Yeah, but I
and all
can't
the
carry that in my
requirements.
bag. If you had a little business card that says Monday here, Tuesday, I could give it and with your number and I could hand them out for you.
Okay. It is also on our website.
But
I will work on getting you
I
some
don't have a
cards.
computer, and a lot of people
Yes.
don't. I can't afford one. But the business card would be perfect. Monday, go here, this, and the times is the same every day, right, Joanne? for
Yes.
each day?
Yes.
Yeah,
Seems
Okay.
like, yes, thank you, ma'am. It seems like that would be a reasonable accommodation, so let's check into that.
okay?
Thank you.
Thank
Thank you for
you.
coming to the meeting.
Any other citizens? Seeing none, we can move on to board member comments.
Vice Chair and fellow board members, I would just like to proffer that today at the Hernando County Board, that we will be having the Florida Department of Children and Families, and I noticed that my sister agency and our fellow board members not here today for whatever reason. Not to speak on their behalf, but to speak on their behalf, we've arranged to have them present the Hope Florida program, which is an initiative by our First Lady. She's bringing this initiative to pretty much every state agency. I had not been asked to, and I know Joy and I conversed about this for this board at this meeting, but since Hernando County is having the presentation today, I would like to offer, and it's a separate person, not our designated person that comes, not our designated board member, it's a separate division of DCF, and I'm in touch with the director of that specific division, and we can make arrangements if the board desires to have DCF present on the Hope Florida initiative, which is a huge and transformative program within DCF, again, touching almost all the state agencies. It's rolling out. This First Lady is rolling this out. We've rolled it out in our own agency, but it launched first with DCF, and I would like to offer that to make the arrangements to have them present at the next meeting if the vice chair and the board so agrees. As a presenter? It is a program where when someone approaches any state, I'll say any state agency, those that have the initiative involved, and again, it's going to roll out to the majority of the state agencies, where we just don't want to turn people away. We want to connect people with resources back into the community, and we want to be, as our director calls it, a connector of dots, plugging people into actual resources. It's basically going back to basics, the way social work used to be, and it's connecting the business partners in the community, the faith-based community churches, and state agencies all in together, and there's what they call a care portal, and it's at a company that's actually set up a care portal, a platform electronically through the internet, but it's an actual system where, I'll give you an example, but DCF can talk more about this, where someone comes in, and let's say they need a gas card because they have a job interview, but they have no money to put gas in their car. They can come in and they'll put in the need that the Hope Navigator, the people that work for the Hope system will put in the need, this person needs a gas card, and the businesses and the churches that are members of the care portal will say, we can help that need, we'll meet that need, and they make arrangements to get that gas card to that person. That is a very basic example. It's broader than that. Somebody might need assistance to get their driver's license. It's a way that government is assisting, but government should not be the only answer. We need to help. We need, as the state of Florida government, whatever agency, whether it's Department of Health, the Agency for Persons with Disabilities, the Department of Children and Families, help to the basis and within the parameters that we can, but we need to connect people back to the local communities, because there is so much out there in the community that people don't know, and it's about breaking down the communication barriers and back to the basics. And I can tell you, having worked, next year will be 30 years for state government, this is the best change that I have seen, and it's really basic. It sounds so simple, but finally, I think we're getting it right, and I'm very excited about it. We're doing it within our own agency, and just plugging people in and trying to help. And they may not have every answer and be able to address every situation, but the fact is that when people walk in to the department, they try. So that's a very broad overview, but the Hope Navigator specialist can come in and give the full presentation, and I think this board and our citizens would benefit from it here in Citrus County. And I'm going to make arrangements, because in my region for APD, I have 12 counties. I'm going to try to have them come to present every board meeting, make their way around the region, because
Do you have a phone number for this organization?
I don't have it off the top of my, and I know you said you didn't have a computer, but do you have access to any? Okay. if I can talk to you afterwards, I can access that and give it to you.
Because I really would like that, because
Okay.
at the DCF where I live over here,
Yeah,
the screen is below the desk and you
Yeah.
can't see it.
Okay.
And nobody will help you.
well, I know at the DCF office, they have it, but I can pull this up and access the number for you, and I can see you
appreciate it.
afterwards
Thank
and give it to you, so. But anyway, I just wanted to present that. Sorry, I gave a little overview, but they'll give a full-blown presentation that's better than what I did there, but.
Honestly, that's some of the best news I've heard in years.
Yeah, it's very exciting and,
Because the good thing about that is, not everybody can do everything yet, but the more positive that we get out of it, more people will come along and that way it will expand where
yes,
we can help each other that way. That's the best thing I've
It
heard
is.
in any years.
it's very exciting.
That was worth coming to the meeting right there.
Okay. All right. That's
I'd
great
like
to
to
hear.
just add about that, the Florida Department of Elder Affairs is also
You're-
very much involved with.
you got it too.
Yeah, with Hope Heroes, and
Yeah.
it's seniors helping seniors in our
Yes.
arena.
It's
so,
great, isn't it?
Yeah, we're very much
It's,
involved with that too.
I'm telling you, this administration, whatever your politics are, put them aside. This administration is transforming social services, how we connect back to us, the people that live in this state, and help each other, so.
And you know, here in Citrus County, we're very lucky that a lot of these entities already work together. But
Yes.
this makes it more structured.
Yes, absolutely.
So, Mr.
Absolutely.
Chair,
Yes, ma'am.
we have Katie Lucas has volunteered from the local medical community to do a presentation at our next meeting, which is on May 9th. So
I would defer if she can get them in here.
we just want to clarify what to do here. So if you want to, for us to schedule you in the following quarter,
You can do the following quarter for me and let her see if she can schedule
get
this one
Hope in,
yes.
okay.
And I would proffer, I will confirm that they can attend, and then if for some strange reason, because I don't want to presume that their calendar, well, I'm gonna hope that their calendar is free, because this is 3 months in advance. No pun intended when I said hope, but
I know
anyway.
what you mean.
You know, but in the instance that they're not, then I would suggest
Then,
that you
yeah.
would, but if they are, then.
They can let me
If
know,
you don't
yeah.
have an issue. that
No,
would
not
be-
at all.
Okay,
That's-
I will make sure
That's a
I,
lot more important.
well, I don't know about that, but, okay.
They're all equally important.
Absolutely.
So. All right, so we will put Hope on unless we're notified, and then we will switch them around for you, so.
Yes, ma'am.
I know what to do.
Thank you.
Any other board comment? Seeing none, item J.
Just a couple of quick comments. We're well underway with our long-range transportation plan, which is our single biggest study that we do. It's, we started it, I don't know, about a year ago, and we will have it wrapped up for the board approval by October. The federal government looks at it as a 20-year lookout forward. The state of Florida looks at it as 25 years. Just looking out the function of what roads are our priorities to build out, and transportation and transit, all of that encumbers that. We're also gonna be doing update our unified, UPWP, Unified Planning Work Program, which is really our financial document, how we're gonna pay for our studies. MPO is basically 100% grant funded. So we get our money from the state and the feds, and our salaries come from that. So our UPWP has to be updated every 2 years, and we're gonna be in the process of that starting here soon. And then we're just doing some additional traffic count studies that I had asked the board a year and a half ago, to do some extra studies on US 41 and State Road 200 up here in Citrus County, as well as County Line Road and parts of the southern portion of US 41 in Hernando County. And the reason we ask for those studies, if the state does come into some extra money for building roads, we want to be able to ask for it quickly. The challenge for FDOT is the escalating costs, not only with labor, but with materials.
Materials.
It's just gotten very, very expensive to build roads, so that's it from our end.
Can I ask a question? Is it possible that we could expand door to door at least on Saturdays? Because they're booked every day, all day. And if we get enough buses, we could do Saturday for certain customers. Well, they and it's like, when you ask for something, the minute they say, they don't have enough this, they don't have enough that, but that guy that just administrative just got $100,000 raise.
But it's not, they're not trying to get drivers.
But, no, I'm talking about on Saturday. It'd be nice
So,
to have them, we could go to the store and shop and stuff, you know?
so we can take a
Literally have
look.
Doctor's appointments.
Right, so we can take a look and we'll talk to our transit provider in Citrus and see what can be done, if anything. So thank you for bringing that to order, or to our,
Yeah, because I think people would take it,
okay. Well, thank you for that.
okay.
So, Mr. Chair, we've conducted the meetings, and you want to make your announcements for our next meeting?
Yes, ma'am. The next regular meeting of the Citrus County Transportation Disadvantaged Local Coordinating Board, or LCB, is scheduled for Thursday, May 9th, 2024, beginning at 9:30 a.m. in Locanto Government Building, 3600 West Sovereign Path, room 166, Locanto, Florida. The meeting agenda and backup materials are available online at www.hernandocounty.us/Hernando Citrus MPO. Meeting is adjourned.
Thank
And
you.
thank you all for this change and shift, and we will be going back to Hernando to have our transportation local coordinating board meeting down there.
Thank you,
Have a
everyone.
great day, everyone, and safe travels.